Hi, my name is Dr. Robert Gilliland, DC. I help people who have difficult chronic health conditions so that they can lead normal lives, have more energy, lose weight, sleep better, and feel better. I help people get their life back. If you have fatigue or if you have trouble losing weight even on a low-calorie diet, do you have headaches that wear off as the day progresses? Are you depressed? Are you constipated? Are you sensitive to cold weather? Do you have cold hand and cold feet or numbness in your hands and feet? Do you get muscle cramps even at rest? Do you catch every cold and flu that comes around? Does it take longer for you to recover from a sickness or an injury? Do you need excessive amounts of sleep to function? Do you have chronic digestive problems? Do you have itchy or dry skin? Is your hair falling out? Are you losing hair on the outermost portion of your eyebrows? If any of these apply to you, I'm here to help. Now, I know a lot of you have already been to see a medical doctor, a specialist, or an alternative healthcare provider, and you still have the symptoms. And I know that you're frustrated, maybe you're losing hope, or you're beginning to think that there's nobody who can help you. I understand your frustration. 3 years ago, I was in the same situation that you're in now. I had a list of chronic health conditions: alopecia areata, ringing in my ears, chronic sinus infection, acid reflux, sliding hiatal hernia, ulcerative colitis, fibromyalgia, shoulder problems, chronic tendonitis, chronic debilitating wrist pain, bursitis in both hips, chronic fatigue, and brain fog. I couldn't make it through a whole day without taking a nap. Every time that I ate something, I became lightheaded and sleepy. And the only way that I could make it through the day was to load up on caffeine. I was drinking 4 or 5 Mountain Dews a day, and I was still tired and sleepy. Now, at this point, when all of these things were happening, I had already been to see many doctors, both traditional and alternative medical doctors. I had healthcare training in both traditional and alternative medicine. I was a doctor. I had spent over 10 years in school and had $250,000 in student loan debt. I tried different diets. At one time, I was on 17 different supplements, but nothing was working. Now, I was highly motivated. I was ready to do whatever it took to get well. There just wasn't anyone that I could find who could tell me what to do. So I understand your frustration. And I got frustrated with my doctors because they couldn't help me. And I really shouldn't have, because it wasn't their fault, because I have learned since they're not trained to handle these difficult chronic conditions. I know because I've seen both sides up close and personal. And I've seen what's available in both traditional and alternative medicine. And the only way that I was able to handle all of my difficult chronic health conditions was to combine the best of both worlds. I take the diagnostics from traditional medicine and combine it with the all-natural therapies from alternative medicine. Now, this was the answer that I was looking for. I no longer have the aches and pains that I had before. My energy level is greatly improved. I can breathe through my nose again. I can sleep at night without having background noise to drown out the ringing in my ears. I can sleep on my side again. My hip bursitis is gone. I don't have the gastrointestinal problems that I had before. I actually feel better and have less pain now than I did when I was a teenager. And what you need to understand is you can do this too. The first question that most patients ask me is, what makes you think you can get me better when none of the other doctors could? Now, my answer is because I do things differently. After 20 years of studying these difficult chronic conditions, I understand what it takes to find and correct the underlying problem. And the first step in handling these difficult chronic conditions is identifying the underlying cause. I have patients, before they come into my office, fill out a very extensive amount of paperwork describing their complaints or symptoms. This gives me an idea of what systems, organs, or glands are malfunctioning. I do a very thorough exam. My exam lasts between 45 minutes to an hour. I then order blood work, lab panels, stool samples, saliva tests. My job is to get enough information to find out what the underlying cause of your problem is, and then to make the necessary steps to correct the situation. We like to think when we go to our medical doctor that they run all the necessary tests that you need in order to find out what's causing the problem. But that's just not how it works. Doctors are trained to run the necessary tests to determine the best treatment. And because they have limited treatment options, they only need to run a few tests. Because finding the actual cause of the problem isn't going to change how they treat you. So there's no need to run a whole lot of unnecessary tests. If you go to a medical doctor and describe the symptoms of a hypothyroid, that's what they're going to check. Because doctors are taught that when you hear galloping, to think horses. Because the most obvious answer is usually the right answer. So if the doctor's treatment options are limited to thyroid medications, T3 and T4, there's only a few different variations. You either have T3, T4, a combination of T3 and T4, or natural or synthetic. Those are the options. So they'll typically run a TSH panel, maybe a T4 or a free T3, and that gives them enough information to decide whether or not you need treatment, whether you need these thyroid hormones. The reason they only run a few tests is because when you go to your doctor's office, you flash your insurance card or Medicare card, you expect that to cover everything. And then in the end, if you end up getting a bill, you get mad at your doctor, and your doctors don't want that. So if they are on your list of providers, they're also under pressure to be cost effective, because if they run more tests than the doctor down the road, when it comes time for the insurance company to evaluate the effectiveness of the doctor on their panel or in their group, who do you think is going to be the first one to go? And if you're a doctor who depends on getting patients from an insurance company, you either play along or you go out of business. So while medical doctors have access to the same tests that I run to determine the underlying cause of your problem, they don't run them for the reasons I just mentioned. Medical doctors get into a situation where they run just enough tests to keep from being sued for malpractice, but not too many to show up on the insurance company's radar. And that's the reason why I don't take insurance. If you have insurance, I'll give you the necessary paperwork to file a claim, but I don't take your insurance as payment because I refuse to play that game. If you can find a doctor who takes your insurance, who can get you well again, then you don't need me. I am here for those of you who are still living with symptoms despite trying all the other available options. What I do is not for everyone, but if you have a difficult chronic health condition that no one's been able to help you with, and you're willing to do whatever it takes to get well, and if I accept your case, that means I believe I can truly help you get well. Now here are the steps to getting your life back. Number one, you need to realize that your problem isn't going to be corrected by some magical pill, potion, or cream. It's going to take you doing your part. This means lifestyle changes, including dietary changes, because what I found is this. When it comes to difficult chronic health conditions, 90% of what's wrong with us is what we've done to ourselves. It's my job to determine what thing or things that you have done to cause this and give you the step-by-step instructions on how to correct it. If you are unwilling to make these necessary changes, you will not get well. If you are not 100% committed, I will not accept you as a patient. So the most important first step is for you to realize that you have a problem that only you can solve. I am basically handing you your own unique, personalized instructional manual. If you follow the guidelines in this manual, you'll get well. If you do not follow these guidelines in this manual, you will not get well. In order for me to correctly identify your problem, I need as much information as I can get. You'll begin by filling out the paperwork on my website. That paperwork needs to be in my office at least a week before your appointment so that I can review it. Now, I read every line on it, so it's important that you fill it out as accurately as possible. This gives me an understanding of what organs, systems, or glands are malfunctioning. The next step is the examinations. My examinations typically run between 45 minutes to an hour. I do a very thorough exam. Next, we order blood work. You'll go to the lab, whatever your local lab, if it's LabCorp or Quest, and you'll have blood drawn. There will also be saliva testing done. You can do that here in the office. We're going to run sensitivity testing to determine if you have sensitivity to gluten, milk, eggs, yeast, or soy. We'll run complete blood panels, complete metabolic panels, a lipid panel, a complete thyroid panel, including TSH, total T4, free thyroxine index, free thyroxine, resin 3T uptake, free T3, reverse T3, free T4, total T3, and thyroid antibodies. We'll also run CBC with differential, C-reactive protein, homocysteine. We'll check your TIBC levels, your A1C, your ferritin, your transferrin, your fibrogen, your uric acid levels, your vitamin A levels, your adrenal stress index levels. We'll check your immune panels, TMB lymphocyte natural killer cell panel, interleukin 2, TNF alpha, interleukin 4, interleukin 10, lymphocyte subpopulation analysis. We'll look at natural killer cell activity. We'll look at Th1 versus Th2 cytokine panel. We'll look at and see if you have intestinal permeability. We'll check your hormone levels. We'll check to see if you have H. pylori, because H. pylori is the most common infection worldwide, and nobody tests for it, or hardly anyone tests for it. We'll check your homocysteine levels, your C-reactive protein. As you can see, I'm very thorough. I leave no stone unturned when it comes to finding out what the underlying cause of your problem is. So if you're ready to get your life back, you're ready to commit to doing the things that you need to do to get healthy, call my office, 239-444-3106.